So if you get into an argument with a coworker, some people will say, oh, I was traumatized. They really just mean they were stressed.
When you say trauma, because it is and it has been more culturally embraced and espoused the past 10 years for sure, how do you define trauma?
Sure. So there is regular stress or ordinary stress, and then there's traumatic stress. And everyday stress just comes with our roles and responsibilities. It's just a part of life. And usually we know how to navigate that. It's like, I have to do this at work. I have to do this for my family, and I have to deal with LA traffic. So I just figure out like how to maneuver it. And then a traumatic stress are these overwhelming experiences that exceed my usual capacity to cope. So if I'm not overwhelmed by it, if it doesn't create feelings of a hopelessness or helplessness or powerlessness, then we will refer to that as stress. So if you get into an argument with a coworker, some people will say, oh, I was traumatized. They really just mean they were stressed. But when we have these overwhelming experiences, that can be a medical event. It can be sexual assault, child abuse, war, natural disasters, a fire, a car accident. When we have these kinds of events, especially if they are long lasting, we can see three major disruptions. So one, it can disrupt your sense of yourself. It's like who I thought I was. And then that gets shattered by the experience. My ability to regulate my emotions. So then we see people or we experience ourselves going from like 1 to 10, right? And sometimes that happening quickly or invisibly. We're like, how did we get here? And the third one is difficulty with trust. So especially when it was an interpersonal trauma, as I mentioned, like a